Welcome to PsychWSigmund, the podcast where we explore the fascinating world of psychology and its relevance to our everyday lives. I'm your host, Sigmund, and today we're going to delve into a cutting-edge topic that's revolutionizing the field of mental health treatment, virtual reality, and psychological treatment. Virtual reality, or VR, is a technology that allows us to immerse ourselves in simulated environments that can mimic real-life situations or create entirely new experiences. When applied to psychological treatment, VR offers a powerful tool for therapists and patients to work together in innovative ways. But before we dive into the details, let's take a step back and understand why this concept is important in psychology. Virtual reality and psychological treatment has its roots in the 1960s, when psychologists like Albert Ellis and Aaron Beck were developing cognitive behavioral therapies that focused on changing maladaptive thought patterns and behaviors. Fast forward to the present day, and we see how VR technology can enhance these therapeutic approaches by providing a safe, controlled environment for patients to confront and overcome their fears, anxieties, or phobias. One of the key theoretical frameworks underlying virtual reality and psychological treatment is exposure therapy. This approach involves gradually exposing patients to the stimuli that trigger their distress, while teaching them coping skills and techniques to manage their anxiety. VR technology allows therapists to create customized exposure scenarios that can be tailored to each patient's specific needs, making treatment more effective and efficient. For example, a patient with a fear of heights can use VR to simulate a gradual ascent up a virtual skyscraper, while a therapist provides guidance and support in real time. This approach has been shown to be highly effective in reducing symptoms of anxiety disorders, such as PTSD, social anxiety disorder, and specific phobias. But how does it work? Research suggests that VR-based exposure therapy can alter the brain's neural pathways, reducing activity in areas associated with fear and anxiety, while increasing activity in areas related to emotional regulation and memory consolidation. This is because VR experiences can activate the brain's default mode network, which is responsible for simulating hypothetical scenarios and predicting outcomes. Studies have consistently shown that virtual reality and psychological treatment can lead to significant reductions in symptoms of anxiety and depression, as well as improvements in cognitive functioning and quality of life. For instance, a meta-analysis published in the journal Depression and Anxiety found that VR-based therapy was associated with large effect sizes in reducing symptoms of depression and anxiety compared to traditional treatments. In addition to its therapeutic applications, virtual reality and psychological treatment also raises important questions about the nature of reality and how we perceive it. As the philosopher Jean Baudrillard once said, "The simulation is more real than reality itself." This idea highlights the complex interplay between our perceptions, emotions, and experiences, and how they shape our understanding of the world around us. But what about the potential risks and limitations of virtual reality and psychological treatment? Some researchers have raised concerns about the potential for VR therapy to induce anxiety or trigger traumatic memories. However, these risks can be mitigated with proper training and supervision, as well as careful screening and assessment of patients before treatment begins. In conclusion, virtual reality and psychological treatment offers a promising new approach to mental health treatment, one that combines the benefits of exposure therapy with the immersive power of virtual environments. By understanding how VR therapy works, we can develop more effective treatments for a range of mental health challenges. As we continue to explore the potential of this technology, it's essential to consider both the theoretical and practical implications of virtual reality and psychological treatment. As we wrap up today's episode, I want to leave you with a thought-provoking insight. Virtual reality and psychological treatment reminds us that our perceptions of reality are always filtered through our individual experiences and biases. By leveraging the power of VR, we can create new realities that help us overcome our limitations and achieve greater psychological balance. That's all for today's Psych with Sigmund. Remember to like, share, and subscribe, and until next time, may your ego find balance between pleasure and reality.